Hi, I'm Dr. Bill Keck, and in this video, we want to review the characteristics of people who work in public health practice settings, or really in any community agency setting, but especially public health. You've got to understand that a health department is probably the only agency that is responsible by law for community health status. That's a lot of pressure. So people in health departments are looking to see what they can do to prevent disease and promote good health. And there are a wide range of professionals involved in most health departments. I mean, you can have doctors and nurses, social workers, health educators, environmentalists, and on. Really quite a variety of people with very specialized interests that have to be brought together under one roof. And these folks have to be very responsive to public concerns. They have to be able to respond immediately to issues that come up in the community, and they have to be able to justify their actions not only to themselves, but to their superiors, to boards of health, to politicians, and to the media, because it's quite likely, if anything comes up in the community of broad interest or that's considered a community risk, the media is going to be all over it, and people will have to be in a position where they can speak directly and truthfully, even in the absence of incontrovertible evidence. Now, this environment tends to have limited resources for workforce training. Resources have been declining here as well, so there will be concerns about how to keep the workforce up to date. Also now, there is a voluntary accreditation process in many health departments. All of them in Ohio, for example, are required to become accredited within a certain time period. And in order to do that, it's really valuable to have a connection to an academic center of some kind. So here you've got this environment that is not only focused on all this public stuff, but darned if the agenda doesn't keep expanding. More and more things seem to come under the purview of public health, including now the so-called social determinants of public health, and at the same time the resources are diminishing. So that leaves these folks in the position of looking for external resources as well. They're looking for ways to support what they do, and they're looking for connections with other groups, because you can't deal with the social determinants of health without involving almost all sectors that exist in a community.